All right, well, welcome back to session 4 of our virtual conference. We are really pleased to have a great team to present to you today about transition to adult care for young adults with spina bifida. So we have Dr. Stacy Cook from Boston Children's Hospital, Dr. Arda Hotz from Boston Children's Hospital, and Judy Thibadeau from the National Spina Bifida Association. So get comfortable because I have a lot of introductions to do. They're very professional people and there are several of them. So first, Dr. Stacy Cook was born in Pittsburgh, Pennsylvania, and received her PhD in developmental biology from Thomas Jefferson University in 2001. She then attended the Boston University School of Medicine and went through her pediatric residency at the Boston Combined Residency Program, Boston Children's Hospital, Boston Medical Center. Following her postgraduate training, she worked for 2 years in the coordinated care program at Boston Medical Center and then relocated to do primary care at Children's Hospital of Pittsburgh. After 7 years of general pediatric practice, Dr. Cook founded the Complex Care Center at Children's Hospital of Pittsburgh and remained the medical director there until she came to Boston Children's Hospital to oversee the Outpatient Complex Care Service. Dr. Arda Hotz completed her residency in general pediatrics at the Children's Hospital at Montefiore in the Bronx, New York, and a fellowship in academic pediatrics with a focus on complex care at Boston Children's Hospital. She currently works in complex care and primary care at Boston Children's Hospital. Her clinical interests include working with children and young adults with medical complexity, including people with spina bifida. Her research interests include optimizing transition to adult care for young adults and medical complexity. And Judy Thibadeau joined the Spina Bifida Association in 2018 as the Director of Research and Services. For the 13 years prior to this, she coordinated the National Spina Bifida Program at the Centers for Disease Control and Prevention, during which time the National Spina Bifida Patient Registry was created and implemented. She's been involved in the care of people living with spina bifida as well as in research to improve that care for 40 years. This work has included collaborating in the development of an independent enhancement program for children with spina bifida, a spina bifida habilitation program at the Shepherd Center, and working with Emory University Pediatric Urology in Atlanta, Georgia. So again, the presentation will be followed by an opportunity for question and answer. So please type your questions in the chat or the Q&A feature at any time, and we'll answer them at the end. And again, closed captioning is active and available for all who need to access it. So without further ado, I would like to say welcome to all 3 of you and thank you so much for being here. And I will just turn it over to you and let you share your screen.
Okay, great.
Okay, thank you.
All right, can you guys all see the right thing?
Yes, we can see your screen. Thank you.
Okay, perfect. So my name is Arda. Judy and Stacey, do you guys both want to say hi just so everybody can see who's who?
Hi, Judy.
Hi, I'm Stacy.
And we're going to talk with you all today about one of our favorite topics, which is transition to adult care for young adults with spina bifida. And this talk, we're going to talk a little bit from the provider perspective. We're going to talk a little bit about the challenges patients have expressed to us over the years. And Judy's going to talk a little bit more about some of the efforts that the SBA is doing to support providers and patients in this area, which is great. So to start off, Stacy and I were going to think through with you why transition to adult care is so challenging. And we thought we would start by thinking through some cases, and these aren't specific people that we follow as much as common types of situations that we've seen. So for example, a 22-year-old might come in with a history of myelomeningocele, Arnold-Chiari-2, a BP shunt, neurogenic bowel and bladder. And maybe their health situation is actually pretty stable and everything is in a really good place in terms of their spina bifida. They're going to college, but they're having difficulty fitting in appointments with their busy life. And that alone can be really challenging for transition. Stacey, I'll pass the next one to you.
So this case made us think of some patients we've seen in our careers. We just wanted to kind of highlight the situation of, you know, a mid-20s, 24-year-old, history of myelomeningocele, neurogenic bowel and bladder, but really worsening depression over the last couple of years. Particularly, I think it's all relevant to think about the pandemic and the impacts it's had on mental health. And, you know, lots of things really are challenging now. So just the regimen of catheterizing, remembering to take the meds, you know, keeping up with mental health care as well and finding a mental health provider, and then also having this added stress and burden of having more clinical needs, like having more UTIs.
And we have another example of an older patient, so a 32-year-old. This would be kind of significantly past when most pediatric practices would aim to transition someone to adult care. And again, with similar medical history, but has had multiple hospitalizations in the past year. And this makes it hard for the patient to transition, but it also makes it hard for the providers because we don't really want to transition somebody who is not stable. And it's just a really challenging situation that we sometimes find ourselves in.
Then finally, we wanted to just highlight the issues of location and resources within the geographic areas that we all live in. And so, you know, 24-year-old, history of lipomyelomeningocele, neurogenic bowel and bladder. So clinical situation may seem very similar to one of the other patients we talked about. Healthcare stable, but just finding the adult providers with knowledge is really, really challenging. And so, you know, what we wanted to highlight with just kind of presenting these little 4 cases was the idea that every situation is a little different and there isn't one way to necessarily do it. And so sometimes it's a medical clinical challenge, and other times it's resource challenge, and sometimes it's mental health challenge. And there's a lot of different things that can really contribute to making transition to adult care a really difficult time for families.
It's rarely a smooth with no challenges. I feel like this is something that's challenging for almost everyone.
So the Spina Bifida Association has learned from clinicians and people with spina bifida, the research about all the things that Arda and Stacy just mentioned. And we did a market survey, not related to transition specifically, but we learned that from patients and caregivers, finding doctors who treat adults with spina bifida was the most important issue. And the issues seem to be related to finding physicians who are trained in the care of people with spina bifida, and the person with spina bifida not having to even define what spina bifida is, and insurance barriers that people with spina bifida, I think, regularly experience. If a physician feels uncomfortable taking on the care of a patient who's complicated, and their insurance payment, it doesn't feel generous enough to the provider. There are less than 30 adult spina bifida multidisciplinary clinics in this country. There are about 130 clinics that treat children. There are more adults living with spina bifida than there are children living with spina bifida in this country, based on an estimate. We don't have an exact number, but that's what we think. So we don't necessarily think the multidisciplinary clinic model is needed for sure, but finding an individual provider is very difficult, as you heard in the discussion before with Pat, that there's not a really refined list of individual providers who will see patients with spina bifida, and we are working on creating that list. We are advocating that there be a test of models of care. As you heard from Stacy and Arda, the issues are all different. People with spina bifida want something different. So whether it's an internal medicine pediatric provider model with access to specialists, or a clinic model, or a primary home with internal medicine pediatric leadership taking care of the patient, or like in Pittsburgh, the physiatry model, with physiatrist-led clinic with other specialists involved and access to, for instance, urology. Next slide. I think it's not me anyway.
So what some of that we wanted to list out, and this is not an exhaustive list, but we did want to kind of just highlight some of the things we see as barriers to, you know, interfering with a smooth transition. And this is a great area, I think, too, for at the end for some questions and discussion, because there's there's often, there might be some things that we may not know specifically too, and we're always happy to get back to you guys about any questions that you have, particularly when it comes to insurance. This is a big one because, you know, if your child, or if you're a caregiver of a child with medical complexity, often your insurance is pretty generous about coverage in a pediatric system because the number of possible pediatric providers is much, much smaller. And so they understand that, and they know that, like, to get your specialized pediatric urologic care, they're going to have to cover Boston Children's or Children's of Dartmouth, because that's the only place that that care can be provided. But as soon as you turn 18 and move into the adult system, right, there's a lot of different people and a lot more provider volume. And so one of the issues that a lot of families really struggle with is, like, now having to reset and pay a lot more close attention to providers that are approved and accepted within their insurance system. And sometimes they've already made the insurance decision before they've checked out the provider piece. And so one of the things that's really nice, if we do this right and we start this process really early, is that we can kind of be really thoughtful about insurance choices, you know, changes with parental kind of usage of their insurance versus having the child go completely onto Medicaid, and then thinking about where the providers they need, are they going to be covered? That's actually really one of the things that can be most helpful and is really can make a difference in taking down these barriers to a smooth transition.
Yeah, and in Massachusetts, it's especially complicated because when you pick your primary doctor, sometimes that can limit where your specialty care can be. And so we have to be very deliberate and thoughtful about who the primary doctor is, or your like a adult PCP, because that might change which healthcare system that we can send someone to or send them to for their specialist.
Yeah, that's a really great point, because that's not really the case with your pediatrician now. So that would be like a complete change of environments for sure. One of the other things that we run into a lot, and in New England, I think we're somewhat fortunate because the idea of guardianship when children turn 18 is something that's a little bit more widely understood, I feel like. In other parts of the country, many families have never even thought about this. But for our patients that have any kind of intellectual disability, or there's any concern that when they turn 18, they should have somebody helping them with their finances, their living, etc., you know, we want to go through the process legally of guardianship. And that's really important in the healthcare setting in New England, because sometimes you can't really get procedures unless there's a way to get legal consent. And so this comes up quite a bit, and we're seeing it a lot in some of our families that are coming from outside of New England and we never have heard of it. And again, this is an area where we probably could spend 2 hours on guardianship, and we're probably not the right people to do it. But we're happy either to, you know, answer questions that we can at the end, or put you guys in touch with people that can be a lot more expansive on their understanding of it. The other thing we find is that there's a real emotional attachment to pediatric providers, and that makes a ton of sense, right? You know, the process that everybody's gone through in learning prenatally, if that was the case, that there was a myelomeningocele present, that there was a Chiari brain surgery, right? Big deal. You become kind of attached to your neurosurgeon, and then the idea of leaving them after they've been there with you, seen you, know you, seen what your child's doing, and celebrated those things with you, that's really difficult. And I think sometimes as providers, we don't always remember that when we say, well, come on now, we can get you over, we'll have you meet so-and-so, they're great, but they're not the person that helped you through that crisis or was there for you in the beginning and helped you kind of understand where things stood. And so we do have to pay some respect to that and know that it is truly an emotional attachment that caregivers and patients have. We also find that a lot of caregivers and young adults sometimes just aren't prepared for the changes that occur in the adult system. There's less maybe proactive tracking of patients or reaching out. You know, they put a lot more of the onus and responsibility on the patient to make the call and make that appointment, and to, you know, if you got referred to someone, call that office, figure that out, that kind of thing. I think that things are getting better in certain larger systems, but it's still not the case. And we would like to see more of the kind of way we think about things in pediatrics move over there as well as part of that culture, but it's still a challenge. Identifying, just as Arda said, she's absolutely right, finding the right PCP, and sometimes that's really the first step, because everything kind of can fall into place from that. I think the good news is that the adult providers, a lot of the practices are very used to handling, it may not be spina bifida, but they're dealing with lots of very complicated older patients, elderly patients. And so they may have a structure that functions as a really good medical home. And so, you know, maybe they don't call it that, but they have it. So thinking about the right person, I think, is really important. The paucity of the trained subspecialist is this huge issue, as we talked about with resource limited areas. Travel time for patients is sometimes a real burden, and just making sure you have the right care team that is available should you need them. And then the other thing to think about is that, you know, pediatrics has often been able to pull together these multidisciplinary clinics where you can kind of come and see everybody in an afternoon. And one of my favorite parts about it is, you know, the other day when I was in clinic, we just added on GI because we had a question, even though they weren't necessarily going to see the patient that day. It makes things so much easier. It decreases all of the out-of-visit communication. It saves the patient another trip. That often is not what you're going to find in the adult system. And so, yeah, navigating that, I think, can be somewhat of a challenge.
And I think that what Judy had said about there being like over 130 pediatric multidisciplinary clinics and like under 30 adults just gives you this a really nice objective sense of the difference between models in pediatric versus adult world. I wanted to just touch base for a second a little bit more about some of the legal challenges that Stacy had kind of started to talk about. So during the teenage and young adult years, one of the most important events in this healthcare transition process is turning 18. When someone turns 18, they are legal adults and are considered responsible for their own medical decisions. So from our clinic's perspective, we are hoping that they are the ones reaching out to clinics to schedule appointments, asking for refills, and updating us with any issues. And in the room, as providers, we should really be directing all of our questions to them, who could present alone to clinic. And I think this can be really challenging for families and caregivers who have been taking a bigger role in the young adult's care for the prior 18 years, which is part of why we have been trying so hard to prepare our young adults to be ready for transition when they get to that point. And many of us, you know, even myself, much older than 18, would want to discuss any large medical decisions with our families or our parents. But for some young adults, particularly those like Stacy had mentioned with intellectual disability, as they get older, they tend to depend more on other people, and they really need help making those big decisions, not really from an advice, but they need help making the decision. And they may need more supervision to keep them safe. And that's really the situation that we consider legal guardianship. It's a complicated topic, made more complicated by every state having a different approach to it. And our Spina Bifida clinic at Boston Children's works hard to kind of help families navigate this consideration and really choose if it might be right for their family. And I think that the other kind of comment that I wanted to bring up that really has come up more and more lately for us in terms of guardianship is lately, because of the pandemic, with the advent of virtual visits and a lot more of medical care really becoming virtual and with communications, many of our patients actually reach out to us in the electronic health record portal. And as providers, this is wonderful. It's really easy for us and we appreciate having the ability to kind of send a quick message back to them if they're worried about something. And in addition to that, I think our medically complex families and caregivers have really come to depend on this healthcare portal to see our notes, to see their child or young adult's lab and image results, and to message providers. So one of the challenges that we face is when someone is 18 without guardianship, they lose access to the portal. And if the hospital has paperwork that confirms that they're guardian, they're able to regain it. But at least recently, with more portal use happening, I'd say that this has been an important driver for guardianship for many of our families.
Arda, one other thing I would just probably also say there, I think, I know we're going to throw it back to you, Jean, or Judy, the elective procedures also, you know, we really do at Boston Children's, for those of you that use Boston Children's, we have to see guardianship documented, otherwise they won't get that procedure through because we have to have the consent. And I speculate that I think Massachusetts is probably pretty rigid on that in comparison to other states. And I think for that reason, it is, right? So I think it's an unfortunate little surprise if you're coming from out of state or you have friends actually that are coming from out of state. It may not be something they've ever run into in their home state. But then when they come to Massachusetts for the hip surgery or something, now it becomes this big issue. And because guardianship is such a lengthy process, it really will put off the elective procedure for quite some time until it can be settled. So I just wanted to throw that out there.
So Stacy and Arda, if an 18-year-old does not have a designated guardian, that 18-year-old cannot consent for a procedure? Is that what you're saying?
No. So if somebody is an 18-year-old and is an adult and has the capacity to make their own decisions, so if they don't have intellectual disability and there's no barrier, then just like any adult, they absolutely can consent and they could have hip surgery. I think what becomes complicated is for some of our adults who do have intellectual disability, and we have concerns about their ability to really understand the risks of a medical procedure prior to consenting. And that's when in an emergencies change everything, right? In an emergent situation, we would always go forward with surgery, but it's the non-emergent surgeries where this is complicated.
Yeah, so like a shunt malfunction, for instance, an emergent shunt malfunction will that will absolutely be cared for. You'll never have to worry about that. Anything that's life-threatening is not a problem. It's just it's the kind of elective stuff that you're trying to clear off the table maybe before you move on to the adult system. And that's where people can kind of start to get tripped up in that process.
Thank you.
And understandably, it is a complex process.
Judy, that was good to clarify though. Thank you.
Right, Judy, back to you.
Okay. You're hearing the challenges of transition. SBA recognizes the challenges greatly, and it is a major priority of the national organization to work to address the challenges on multiple fronts. We've hired a new consultant to whose job is to increase the number of informed adult care providers. And we're doing this by in a lot of ways, but working with professional physician nurse organizations to find out of interest to take care of people with spina bifida and to see where training is needed. And then to develop training modules for physicians or advanced practice nurses so that these people could become familiar with the condition and interested in taking care of people with spina bifida. We have currently surveyed physical medicine and rehabilitation providers, they're called physiatrists, PM&R, for interest and barriers. We don't have the results of that survey. Again, we would go to them with a curriculum for how to care for people with spina bifida. A lot of the issues are complex care issues, but then there are the specific ones like particularly bowel and bladder and skin, which could happen to other people as well. Shunts can happen to other people as well. But the complexity of spina bifida and the childhood activity in their care sometimes is of concern to adult providers because they may say, I don't want to operate on you because a lot has happened in your pediatric years and I may not understand it when I get inside there, and then it would be problematic. The Spina Bifida Association has a clinic care partner program. Boston Children's is one of our partners. Clinics apply to be a partner with us based on their use of 10 standards. Their basic standards, all of you would think they're what should be in place in clinics. They're not in place in all clinics, I will say that. But transition, preparation, and execution is one of the 10 standards. And it starts out with, you have to have a transition policy. And write down what it is your clinic is going to do to prepare parents and children to transition, meaning, you know, learn to do their own medical care things, procedures, appointments, and then have someone on the backside, the adult providers who will receive or who can be recommended as an adult provider for a young adult with spina bifida. We have, just to update you on the standards there, we have 37 partners now. Our goal by next year is 50. I don't know if we'll make it because, again, the standards are not amazing, but they are really, really important to the care of people with spina bifida. We have founded the Child to Adult Transition Coalition for Health. This is brand new. SBA is working with our lobby firm to identify other organizations, for instance, the Hydrocephalus Foundation, the people that work in muscular dystrophy, to find leaders that will work with us to improve this situation nationally. Because it really isn't only about spina bifida, it's about children that were born with a complex condition who now live to be adults, and those providers haven't been trained in the care of the young adults with these conditions. So this organization called CATCH is looking for people who will come to the table from an advocacy perspective and then from an implementation, better transition processes perspective. We have developed transition preparation materials for teens. You can find those on the Spina Bifida Association.org website. And SBA has participated in an effort with the American Academy of Pediatrics and CDC to improve transition effectiveness of spina bifida clinics. And the two issues that have been resoundingly noted, insurance is a barrier to transition, and finding an adult provider to be the catcher. And to the child leaves, and there's nobody really to recommend who can take care of the child, because you don't want to travel far. And that's, you know, I think it was mentioned earlier, well, maybe it was in the bowel management, but you can go to maybe Boston, but even Boston doesn't have a clinic. But I bet you Boston pediatric providers can recommend adult providers that can see you as a person with spina bifida. The other thing we are working on is developing a curriculum for training doctors in the care of people with spina bifida.
Great.
Yeah, and just to kind of take off on that a little bit too, Judy, when you were talking about like finding spina bifida trained providers, one of the things I found kind of fascinating coming back to Boston, and I just want to encourage people to not be too despondent if you feel like you're just because you're not in greater Boston metro area. One of the actually interesting side effects, I don't know what you think, Arda, if this is true, but I've noticed it, because there is a large number of pediatric surgeons here, or surgeons that do these complicated pediatric procedures, some of the adults, even though they probably would be doing them if they were in, say, Omaha, don't do them at all here because they've been here a while and they know they can refer. And so you'd be surprised. I want to make sure you guys know that like there's probably like a Goldilocks spot of size, rural, urban, suburban that actually works out sometimes in a patient's favor, depending on the strength of the healthcare system and where you live. Because in some cases, we sometimes struggle with finding a provider that's truly in the adult system because they've relied on their pediatric colleagues who are better trained actually to do those procedures, whereas in maybe other areas, they are seeing more of a mix, don't have those pediatric specialists, so they actually do them and feel comfortable with them and are good at it. So I just want to throw that out there. It was an interesting thing that I just, had been realizing over the last year or two since I've been here. So one of the things that we sometimes talk about amongst ourselves, and, for Arda and I a lot when we're talking, to our primary care colleagues is, how can we as pediatric providers support transition? And not only do we talk as peers, but we really do talk a lot about this for our trainees, our medical students, our residents, our fellows, because this is just something that they fundamentally do need to understand. And so what we really do try to encourage people to do is establish and maintain their partnerships with adult providers. And this is where technology has been our friend with this. Back in the day, not everybody, I mean, it sounds silly, but like if you can imagine, the adult surgeon didn't have a cell phone on them. The only way you got a hold of them was a pager. And if they were busy, they'd have to call back and managing all of that. I mean, now everybody's got a cell phone available. We also have this really explosion too of electronic, password protected, safe systems to communicate with providers outside of our own healthcare system in a protected, HIPAA-friendly way. And so even email doesn't even have to be a barrier. And so I find it actually really pretty easy to pick up the phone and call somebody and leave them a message at their office. And then we touch base and we exchange information and we figure out how what's the safest way to communicate, and then that's what we do. And then now we have this relationship, and maybe we refer patients, but maybe we just call and say, what do you think about this? And that's really how we learn. And then I think we provide better care once we understand what's coming on the other side of it. It doesn't do us any good as pediatricians to give you advice on how to transition to an adult system we don't understand. So the more we silo ourselves, the less helpful we are. And so I think it's just an important piece that we really want to emphasize to people that are in this space. We've really, really beaten the drum for a long time in pediatric education and in this space that starting early is key. I mean, early as 10 or 11, preparing patients and reinforcing the benefits of working on this early in life and often. And, I just have a newly minted 12-year-old, and I really watched myself. We went to check in to get her COVID vaccine, and I let her say her name and her date of birth, which shockingly needed a little bit of prompting. I think she was a little nervous. But that just even allowing them at that age to speak for themselves, say hello to the person checking them in, say their birth date, say their preference. Would you like to sit here? Would you like to wait in the waiting room? Those little things really matter and empower them at a very young age. And they're really capable of it in many ways. Sometimes even though we don't see that side of them at home, they always shock us. So I really encourage not only the parents, but the providers to speak to the patient directly and try to involve them in the conversation. That's really important. And then the issue of warm transfer is, I think, really important. And this, again, where technology is our friend. Now you can get on a Zoom, if it's the patient's first visit with their adult provider in, a spina bifida based clinic, you can get on there and be that friendly face, and you can see what the family is experiencing a little bit and help them kind of navigate it. I mean, it'd be great to go physically if you can, but if it isn't, I think we don't have to let that be something that holds us back from participating in the process with our patients. And then always being thoughtful about that right time to transfer. And I think, Arda mentioned earlier a situation with a patient where they were actively sick. Just coming out of the ICU is not the right time to say, why don't we get you over to adult providers next month? I mean, that's just not the right time to do that, right? So, we really have to, as providers, be thoughtful about what makes the most sense.
I'd like to add one note to what Stacy's saying about starting transition preparation early. There's a wonderful article written by some advanced practice nurses in the field that said transition really begins at birth. When you encourage the development and the embracing of normal developmental milestones like chores when you're 3 or 4 and you need to set the table or whatever it is. But the issue that we have recognized at Spina Bifida Association is people that don't have a complex condition like spina bifida can be sketchy about their adult care, like in that 20 to 30 year decade when who knows what kids that young people do. People with spina bifida need oversight, need to watch their kidneys, need to be able to not have to go to the ER for whatever they comes up and they don't know where to go, or for skin breakdown. So that's why it is so important to encourage all those adult behaviors early. You know, what is your birthday? How do you order your drugs? All the things I know Arda's going to talk about in a minute, to start that early when they might be interested in doing it, so that maybe in that first decade after pediatrics, they don't skip care and get into a kidney problem or a skin problem. So thanks for the early note, Stacy.
My pleasure. And so some actions and suggestions that we often give patients and families when we talk about this process with them. I really think, approaching it with an open mind and projecting confidence, I just can't speak to that enough. I think that we get so used to, as parents, talking to our child's healthcare providers, sometimes as if they're not in the room, right? And if we're nervous about it, they're going to be nervous about it. We forget how much they take in all of the verbal and nonverbal things that we're emanating. And so it's really, I think, important to just keep that in mind. If you're worried about it, feel free to reach out to the provider privately. That is always welcome. We really do understand that. I never question a family if they're like, send me an email. Hey, I just wanted to let you know about this. This is going on and I'm nervous about it. I'd like to talk to you separately from it. Fine, it's no problem. But because we want them to really feel empowered and confident as they move through the process. I think working towards developmental milestones that facilitate independence, I think, are really important. And this is really, somebody I think in the chat brought up Dr. Quealy from our Spina Bifida clinic, and she's amazing and she's really good at this. And I remember it actually made me think, as we were preparing the presentation, I remember when I was a resident once going in to see a family of an asthmatic, and the poor child had been admitted recently with another asthma attack, and the mom was just really frustrated that the child wasn't remembering to take her meds. But she was 8, right? And so just the thing is, developmentally, she probably wasn't ready to assume 100% of her med administration. And so it was just one of those circumstances where the mom meant well. She was clearly on board with the idea of the child feeling empowered and wanted that for the right reasons, but was maybe asking them to do a task that wasn't developmentally appropriate. And I'll be honest with you, and I say this as a parent and a pediatrician, I think sometimes this is where our developmental colleagues really can support us on that, because we don't even always know sometimes. There's such a wide range, and that's partly what their expertise is. Just as, the great Dr. Worf has their expertise in neurosurgery, Dr. Quealy has this expertise in kind of understanding the nuances and the really specific granularity of that adolescent mind and what they're thinking and what they might be able to handle. Really even more in a way than even Arda and I probably could. Not that I want to speak for Arda, but those things I think are really good to lean on your pediatric spina bifida experts right now, because that can be really important, giving the right task and the right responsibility kind of for that right developmental phase. I think getting the school involved and the self-management, if you can incorporate that into the IEP, man, that's just another environment in which you're reinforcing their empowerment, you're giving them control, and you're also allowing kind of a non-caregiver person to be involved in that process, which sometimes takes a little bit of the emotion and anxiety and all those things that are wrapped into that kind of caregiver parent child relationship. And so sometimes there's a lot of positives that can come out of utilizing your school-based resources when they're there, and then continuing to set those realistic expectations. One of the things that I love that Dr. Quealy uses in our clinic is, because I hadn't really even thought about them, but again, technology is our friend. There's a lot of great ways that we're using technology, either like the smartwatches or I love, she often gives advice about how to use bracelets and to track tasks. You know, they don't, you know, an 11-year-old doesn't have, you know, a huge binder that they're carrying around with their day planner in and their little check boxes. They're not thinking that way. Their minds just don't work that way. So kind of setting them up for success when it comes to self-management, I think, is another really big key.
And I think this is, Stacy's discussion is a really good segue to just thinking about transition and transfer readiness. And it really is all about developing the appropriate skills and working on the appropriate skills at the appropriate times. And some of this is developmentally, like when somebody is ready based on their age. And then some of it is also very individual because, you know, not all 9-year-olds have the same maturity and are ready for things at the same time. And the same goes for not all 13-year-olds and 14-year-olds. And, you know, one of the things that we think about a lot in our clinic is some of the readiness skills that are specific to our kids and young adults with spina bifida. And some of that might be catheterization supplies, gathering supplies, ordering supplies, and doing catheterizations. Medications in terms of asking for refills, knowing what your medicines are for, and knowing what to do if you are going to run out of them urgently. Transportation, coming to clinics, coming to clinic visits, coming to urgent visits, how do you do that? And just generally scheduling appointments. You know, when we think about this big transition from the pediatric to the adult system, our goal in an ideal world is when the young adult transitions to the adult system, they feel like they can be the leader of the ship. Which means that they feel like they know how to recognize signs of illness for themselves. They know how to order their supplies and their medicines in a way to keep them safe. And they know how to remember to do the procedures or caths or take their medicines that they need to keep them safe. And then they know how and when and who to ask for help. And there's actually some pretty cool resource that exists already out there to help us think through transition readiness. And this is a questionnaire not specific to spina bifida, and it's actually just like a screenshot from a questionnaire because it's about double this length. And this is from something called GOT Transition, which is a federally funded National Resource Center on Healthcare Transition. And it includes components like understanding someone's own health, understanding when to seek care, and understanding how to communicate with the doctor's office. And some examples of what they say here is, I know my allergies to medicine, and it's no, I want to learn, or yes. I have a way to get to my doctor's office, or I know how to get a referral if I need it. So these are some general skills that are really useful for navigating the healthcare system. And providers can start to use these type of forms. And I know our clinic is planning on instating this soon, using kind of a combination of questions from these forms to help support and identify, well, what skills does this person need to work on? And actually, there is some pretty cool research that has been done out of from a team from Tennessee and Alabama that had a supplement to this form. So this is not really replacing that previous form, the track, but it supplements it. And has some questions really specific for spina bifida. And I can give you a couple of these examples too. So they have one, do you know how to tell if something is wrong with your shunt? And then the answers for these are a little different. It goes, no, I do not know how. No, but I want to learn. No, but I'm learning to do this. Yes, I've started doing this. And yes, I always know how to do this when I need to. And they have some further questions about addressing bladder problems, how to know if something's wrong with your skin. Some really, really helpful questions that can really, really support our young adults with spina bifida. And so I think, you know, for providers to use what's already out there and some of this research that's already been done to support our young adults would be great. And I know that's something that our clinic is very excited about. Pass back to Judy.
So some resources that are available now on the Spina Bifida Association website are guidelines for the care of people with spina bifida and an app. And you can access the guidelines and a link to the app on the website, and there's the link there. And the guidelines were launched in 2018. They are for people of all ages with spina bifida, which is an addition to the guidelines. And some related ones, in addition to transition, are self-management and independence, and health promotion and preventive healthcare services. So these are for clinicians. You should share them if you're a clinician. I'm sure the clinicians at Boston Children's know these and use these. But if you embark on adult care with a new provider, you might make sure that that person is aware that these exist. They're based on science and on the best opinion of experts who care for people with spina bifida, because there's not enough science on this care. There's also a pediatric clinic discharge worksheet that's really helpful. What kind of information might you take or should you take to your adult provider? And that's something that you can access and print and work with your pediatric provider or clinic to complete the information so that your level of lesion's known, the drugs you take, the surgeries you've had, and we think that can be a helpful document as well. There are also information sheets on transitions into adolescence, because, you know, transition happens from the time we're born. So transition throughout life. And then urology has taken a specific and intentional interest in transition. I think Arda or Stacy mentioned that often the pediatric urologist will care for adults. What you hope is they have privileges at an adult hospital, because often pediatric hospitals can only go so far and are really not the environment that maybe adults would prefer to be in. Anyway, so there is a transitioning urologic care. And again, you can go to the spinabifidassociation.org/transition for those documents.
And you know, Judy, we were putting the presentation together and I was kind of looking at this, I was reminded, and I think I brought it up to Arda recently, I want you guys to all feel empowered. Use these resources, especially if you have a willing and engaged provider. Maybe they haven't had experience, but if they're willing, these resources can be useful to them. You know, nurse coordinators in an adult clinic. And the reason why I say that, you know, we do that to each other, that it would not be unheard of. I was thinking back in Pittsburgh, for instance, when you in primary care would get a heart transplant patient, they actually would send us a binder, and it was a great binder. It really, I mean, I'm a physician, but I needed that reminder of what I should be looking for. And they actually had a whole page on what to do for, you know, episodes of diarrhea or episodes of vomiting, what that could be, what you want to do. They always allowed themselves to be a resource. So that was always nice, and that may, you know, not necessarily be the case here in terms of them having some backup, but that's also something that, you know, your specialty provider can do too, to reassure a PCP that, like, hey, you can handle this. This is really what we think is standard of care, you know, and it doesn't take a lot to kind of flip through this or use it when it's needed. And, you know, I just wouldn't want any family to feel embarrassed by doing that, especially if you had a provider you really liked and felt was engaged.
And the guidelines of the care of people with spina bifida is like a really good resource for providers for that. And there's actually an app, which I've had some families like download to their phone, and they show me in clinic. I mean, it's really, really useful.
And that app also includes a place where you can write issues about your own, like how well you slept, what medications you're taking. You can take that with you. You can complete it and take it with you to your physician to help, because they say, well, how are you sleeping? Well, last night, but how about 2 months ago? So you can have that kind of information on the app so that you can share it with your physician. One last resource is the National Resource Center at Spina Bifida Association. You can call us for anything. We do have a list of adult providers. We haven't verified that list, but we give out names. If somebody told us they go to this physician and you're in a certain state or city and we have a name, we will give you that for providers. But we can also provide other information or research other information for you if you have needs or issues.
And in addition, like clinical resources, in addition to the GAT transitions and the Spina Bifida supplement, I just reiterate what Stacy was saying. Look out to your clinic. I know in our clinic, our neuropsychologist is Dr. Queeley, has been an amazing resource for me as I've learned a lot about transition over the last couple of years. And I think we have people with special interest in this, social workers. There's a lot of things, a lot of people have different perspectives and can bring different information and knowledge to the table. And your Spina Bifida clinics are really wonderfully posed to do this. And I think, Judy, this is a picture from the Spina Bifida Association of people with Spina Bifida parents who've come together to advocate. And this has resulted in things like the registry.
Right. Yeah, this is our North Carolina contingent. Well, the last time we did it in person, which was probably in 2019.
Well, I think that's the end of our talk. Thank you so much, everyone. And I think we are hoping to take any questions people have and open it up for discussion, if that's okay.
That's fantastic. Thank you all so much. That was really, really well done. And as you were talking, I opened up my app and, oh, of course, my background is going to be messed up. You're not going to see it, but the questions and clinical questions and guidelines on transition start at 0 to 11 months. So never too early to start asking those questions for parents and start making those preparations. So there it is. You can all see it. So it's right on your phone. So much of what you said really tied into what some of our other speakers have said today in terms of preparing early. I do want to share with people that we had a speaker specifically on guardianship at our Teen Empowerment Weekend a few weeks ago. And not only is it a long process, as you all highlighted, but one thing that hadn't occurred to me, and I think to the parents, is that because of COVID and the backup in the court system, it's an even longer process. So really important to start that conversation early. It's, we cover all 6 New England states, and there are different rules and guidelines in all of those states, but not surprisingly, Massachusetts is very particular, as you pointed out. But so just to reinforce what you said about really starting early, and there are multiple levels of guardianship, conservatorship, all of that. So talking with someone who can give you advice on that is really important, and we can help connect you if that's a need that anybody has who's on this call. So we do have a couple of questions in the chat, which just went away. Sorry. Let me, I don't know how that happened. So one question about guardianship. It's a major topic of debate in the broader disability community right now, particularly when it comes to balancing support and encouraging independence. So are there steps that should be taken before seeking guardianship, or are there tools and suggestion for balancing support and agency for the patient when including guardianship in the transition plan?
So I think this is a great question. And I think, the thoughts involving guardianship are really shifting quickly in different places more than others. So some areas of the country, in some places guardianship is very controversial, and in some areas of the country really are leaning more towards things like shared decision making. And I think from a provider perspective, you know, we want to do what's right by your child or your young adult. And I think that one of the challenges that we face is because the Massachusetts, at least, is definitely still supporting guardianship, then our hospital systems are dependent on it. And so in this situation where your hospital systems are dependent on it for things like elective surgeries and for you to have access to your child's and your young adult's medical record, we really end up advocating a little bit more for it just because we want you to be successful as you're navigating our healthcare system. But I know that this is really a difficult topic. And I do sometimes wonder what the thoughts are going to be about this in 20 years, because I don't know. But right now, using the best information we have, and at least in this area, it seems like most of the time, this is something we advocate for kids with intellectual disability.
Well, I think I'm sorry. Thank you.
That being said, the most important thing I said would be, I would say is to talk with your team, because we do, you know, there are definitely situations where our team will talk with you about options about full guardianship versus partial guardianship. There's actually lots of different options here. And sometimes even in families, children and young adults with intellectual disabilities, after talking with the family, guardianship is not the right answer for your family. And so I think that that's totally reasonable. We just want you to know your options, and we want to be with you to support you to make the right decision for your family.
I think that's
I was just going to say, and updating the neuropsych evaluation on a regular basis, I think is one of the things that also adds time. Getting, especially if there's, like I think Arda was referring to, if there's any kind of question of whether it's appropriate, I think you want a truly independent and thorough evaluation. And so you may want to do that outside of your school system, for instance, or whatnot. So, but getting those appointments and getting them lined up can take months to begin with. And that's on top of you need that in order to get the paperwork done.
We had a comment in an earlier session from a parent just about how difficult it is as a parent because of the complexity of the medical questions and issues, you know, to make that transition. And I think, you know, 18 is very young, right? Like a typical 18-year-old can barely manage their own medical care, never mind with the complexities of, you know, multiple systems involved. And so I think, you know, the information that you guys are sharing is so important, because there isn't there's not an only one option that you can really, especially the earlier you start and the more information that you gather, data that you gather about your child, the more options you're going to have, or the better tailored decision that you can make that's going to be the right fit for your family.
And Jean, I think you're right. I think that it's challenging because we are expecting a little bit more from our patients than we are from other kids and other young adults, right?
Right.
So I think that many 18-year-olds who are coming out of our primary care clinic probably are not coming out with half of the skills to manage their own medical health that our young adults with spina bifida are. And that's why we try to give them more intensive supports in the clinic, because they are going to be responsible to do for more than adults without medical complexity.
I think the tools that you guys have identified, the questionnaires and all of that, are so important. One of our speakers, Dr. Dudley, earlier today was talking about, you know, start very early and focus on one or two things at a time, because it's overwhelming if you're going to try to check off yes on everything on that sheet on your first visit. Who can do that? So I think, you know, taking the long approach and building gradually towards independence over time is such an important thing. And I think, you know, it's great that the national organization is really taking a leadership role in this and providing those resources. But but also at the same time, helping to encourage the development of more medical providers that can be there, Judy, as you said, to catch these patients as they're transitioning on. So, it's, you know, you got to have both pieces of the equation moving forward hand in hand in order to really help people have better access to medical care as adults. It struck me when we were talking about geography too, you know, the simple decision of where do I want to live as an adult? Do I want to go to college? To be able to check with the resource center and see, you know, are there medical providers? This is my dream college. Are there medical providers in that area that if I have an emergency that, you know, that I can reach out to, just for people to know that they can reach out to you. And again, that's taking a lot more ownership of your own medical care than most 18-year-olds would do, but such an important step towards independence and, you know, autonomy.
I think that's a great resource, Judy. I'm definitely going to reach out to you for some suggestions in the future from providers.
Yes, I don't think there's anybody on this call who can't attest to the fact that Juanita is wonderful and very resourceful. We rely on her heavily when we have a question that we can't answer as well. Are there any other questions? Please feel free to put them in the chat or in the Q&A, and we can get these experts to answer them for us. I know we had a question, is there an adult clinic on Long Island? And there is not. Judy, how would people find out where there are adult clinics? Is that on the
national? Well, on the website, it'll tell you the ages that clinics serve.
Okay.
That we know of. And I'll tell you, we don't know everything. We're updating our clinic information right now. We did a survey of all the clinics, and then we'll follow back up with phone calls because they don't all answer us. And then we will, actually, we're going to reach out this time and ask for the specialist, is the subspecialist in the pediatric clinic, so that we have their contact information so that we can communicate with them. But we would go hunting, and often we ask chapters what they know. Adults with spina bifida tell us who their providers are, and we add them to our list. But call us look on our website for the clinics, or just call us and we'll help you figure it out.
Do you feel that, you know, with technology changing and telehealth really exploding, especially during the pandemic, do you feel like people are going to be able to access, you know, an expert across the country, at least in a consulting role, more and more? Are there insurance issues that get in the way of that, or what do you think?
Right now, it's important for our patients, I think, and families to understand that in theory, the practice of medicine occurs where the patient is, not where the provider is. And I'm not personally licensed outside of Massachusetts. There have been a lot of waivers over the last 18 months to kind of cover that. But more broadly speaking, I do think that's where we're headed, which is great. The catch-22, I think, and this is just important, I really want to make sure people kind of hear that, is maybe there is a specialist that you get connected with in Texas. That's great, but if you don't live there, right, then you have to be very careful with detaching yourself from your local team. Really, the team, your primary team, should always be local. And we run into this all the time at Boston Children's. I mean, it's mind-blowing, where we get referrals from families that are far, far away, and they want us to be their home. We want to be their home, but they're not physically really with us on a regular basis. So when acute issues come up, we really struggle with helping them because we're not there, and they can't come see us. And ultimately, I worry about whether that care is still high quality or not. And not actually more than that, I think the emotional stress to be in an environment where you just didn't feel like you were covered, I think is really just too stressful. So I think it's okay. I think if you're going to access providers across the country, I think one-off questions, second opinions are great, but I would never, ever use them to exchange for your local team as you go forward, if that makes sense.
That's a very good point. We did have a question. How would I go about identifying a PCP in the Boston area for a person with spina bifida, and what questions should they be asking?
I can take that one. So I do a lot of work in trying to make relationship with adult PCPs in the greater Boston area for transitioning our medically complex adults from clinic. And one of the things I would start thinking about is, well, what specialists are you thinking to transition to? And so if many times from Boston Children's, we're transitioning our young adults to the Brigham network if they live locally. And so sometimes it's helpful to have a PCP, if you live around here, that's associated with the same network that your specialists are going to be. That can be helpful because then the PCP can see notes from the specialist. They can communicate more easily with the specialist. And so if you are looking for somebody close to this area, I would think, well, what network am I looking for specialists? And then within that network, let's find the practice closest to your house, because we really want somebody would be close to you in the event of like you needing a quick evaluation. And if you are a patient at our practice, we're happy to help you with that.
You want to reverse engineer it based on the specialists that you feel like you're going to need to see.
Exactly.
Yeah. There is a question in the Q&A. I don't know if you can see that. It's very medically dense. So if you can read that, that's probably better. If not, I'll read it to you.
Oh, here.
In the Q&A, yeah.
So someone is describing that her daughter, 32, nearly passed away from sepsis. And after caller, we haven't seen her until the call. Hold a sec, let me just read ahead and to make sure I can read it. It looks like this mom was looking to find a urologist to accept her, but the hospital refused transfer. There weren't any beds due to COVID, and then the severity of the damage was definitely due to neglect. It sounds like this is a really challenging case where they're describing needing legal advice. You know, I think in these situations where if young adults are really, really sick, and you're in a situation where there's been some sort of really serious thing happening in the hospital, and you're in a situation where it sounds like they're calling like legal support, I think that you should probably go back and talk with your primary team who knows them best, and they would probably be the best people to advocate for you. You know, I'm sure Stacy has been in this situation too, and I know I have, where something's happened to one of my patients and the family will reach out to me while they're inpatient. They say, look, this is happening. I just feel like things are out of control. The team doesn't know me here. And then I'll call the inpatient team and I can say, hey, I've known this family for a long time. What can I do to help? What information can I give you? How can I advocate you for when they get discharged? And that's been really successful, because I think sometimes when people, when people are really, really sick and you're meeting the inpatient teams, even if they're doing their best, sometimes they don't realize everything that somebody can do, or the people that they usually are, because they're only seeing them when they're really, really sick. And I think part of why I love our job, and I know why Stacey loves our job in outpatient care, is because we get to spend a lot of time with people while they're well, and we get to really know people. And then when and if they get sick, we can be in a better place to really advocate for them, and help them as they transition back to the outpatient area. So that's probably what I would recommend, would be to talk with your outpatient team.
This situation makes me think of a follow-on question to the guardianship issue. And, this is maybe out of the realm of your expertise, but are you seeing adults with maybe a healthcare proxy as opposed to a guardianship situation, so that if they are very, very sick, they can sort of give somebody else control over their temporary control over their medical care.
Yeah, so actually when you're 18, if you are not, if you're not planning on guardianship, then you really should be signing over a healthcare proxy for if a situation comes up where you can't make a decision for yourself. This is who I would want to talk for me. And that's something that actually all adults typically do. And when you register, I know when I first registered at the hospital here for my first time like outpatient appointment, they made me sign a healthcare proxy to my husband.
Excellent. Okay. Thank you. I think that we answered all of the, at least the medical questions, maybe not the legal questions. Thank you all so much. And I know we went over time, so I appreciate your extra time and patience, as well as your expertise. This is such a huge and important issue in our community, and we just really can't talk about it enough. So we're so lucky to have all of you working as hard as you do on behalf of all of us, and just continuing to expand access going forward for people. So thank you very, very much. We really appreciate your time.
Oh, thank you. It was our pleasure.
Thanks, Jean.
Thank you.
Bye.